Cranial dysfunction. Today's topic is going to be about how cranial dysfunctions can cause problems and what are the solutions that we can offer. You all might notice that in our videos we are not always talking about all the solutions that are available out there. We are talking about the solutions that we can offer at the White Elephant Clinic as osteopaths and craniosacral therapists, because it's always best to talk about what you expertise in instead of talking about everything under the sky. Cranial dysfunction is one such problem that simply means cranial, the skull, and a dysfunction, something not functional about it. Simply meaning that the head or the skull is not properly shaped, is not properly round. How should a skull typically be? Round. But sometimes you would have noticed with newborns that their skull might not be entirely round, but sometimes cone shaped, sometimes elongated, sometimes narrowed, sometimes bulge in the back, bulge in the front, the flat heads on the side, flat on the back, flat on the top, multiple presentations like this. I'm just talking about a few common presentations so that you will be able to relate with what I am talking about. Now, what can these head shapes being weird or a dysfunction cause as a problem in this child? It can cause a lot of tension patterns of pull and push in the musculoskeletal system. Sometimes noticing that these babies use their right sides more prominently, left side less prominently. They're more looking only on one side. When they're sleeping, they're always sleeping with their head on one side. So many of these issues, right, leading to a lot of tightness in their neck, their shoulders becoming crunched, their legs always held back, maybe a presentation of colic or indigestion, not feeding well, their jaws having tightness, so they're not breastfeeding long enough, leading to lack of nutrition, making or forcing the parents to also give them a top-up feed with formulas, right? So many of these problems can happen. Now, what is the solution to this? Well, craniosacral therapists and osteopaths are the best found solution up until date for this problem, because mark my words when I say this, because there is not any other therapy, allopathy, medication, anything that can correct this so soon and so precisely as osteopathy and craniosacral therapy. With just a few sessions of this, not just the head becomes round like a ball, extremely perfect, but also ensuring that it's correcting all the trauma, all the tension, all these patterns that have been collected in the musculoskeletal system, in the connective tissue, in the fascia, leading to so many of these problems that we discussed before. Just 2 or 3 sessions on an average to a newborn child, and miracles happen. To know more about how craniosacral therapy and osteopathy has contributed to such newborn babies, read our Google reviews. You will find a lot of them there. Okay? See you in our next video. Like, share and comment if you found this video informative, and share it with a newborn, a couple who's had a newborn, a couple who's planning a family, or anybody who loves children.